Welcome to the BD India educational video on Grosjean peripherally inserted central catheter maintenance. The peripherally inserted central catheter is a type of tube that is inserted into the vein of the upper part of the arm and moved up to the larger vein leading to the heart. The purpose of the Picc line is to provide a safe access to ensure proper care delivery. Grosjean peripherally inserted central catheter lines are a trusted option for many doctors and caregivers for years and are a standard practice in cases where drug delivery is done directly into the bloodstream. The Grosjean line has the advantage of a superior catheter design, which makes it easy to insert and remove. The Grosjean valve design is such that it controls the flow of the fluid, allowing better control over the entry of medications and other substances. It is also helpful in reducing the backward flow of blood and clotting, thus eliminating the use of anticoagulants like heparin. This helps in making it easy to maintain and to lower the cost of weekly care. A peripherally inserted central catheter has several advantages. It's a bedside procedure done under local anesthesia. It roughly takes 1 hour to complete the insertion. It's a daycare procedure, hence same-day discharge, and it's easy to maintain. Picc is designed to ensure continuum of care, reducing vascular complications. The peripherally inserted central catheter is a type of tube that is inserted into the vein of the upper part of the arm and moved up to the larger vein leading to the heart. The Picc can be in place for up to 12 months. During this period, it needs to be regularly cleaned and the dressing should be changed by a competent caregiver once a week, or if it becomes soiled or loose, failure to do so might attract infections. To achieve a successful peripherally inserted central catheter line, there are several aspects that need to be taken care of. Some of the aspects include cleaning the insertion site and applying a clean dressing, flushing the catheter regularly, changing the needleless connectors, and foreseeing the problems and troubleshooting. Site care and dressing change involve maintaining a clean site and regular dressing change. The requirements for site care and dressing change include an alcohol swab, gauze piece, mask with ear loops and sterile gloves, polydrape cloth, chlorohexidine gluconate solution for site prep, transparent semi-permeable dressing, posse flush, connector, Max Zero, sterile gloves, stat lock and dressing set, that is tray, 2 bowls, forceps. The ANTT, aseptic non-touch technique is used to change the dressing. It is usually carried out by clinicians. It is performed to avoid infection at the site. The key parts to be monitored in the Picc line dressing change are the peripherally inserted central catheter hub, tip of the syringe or syringes, and the ends of intravenous tubing and needleless connectors. Position the patient to allow access to the site. The first step in peripherally inserted central catheter dressing change involves the following. Wear a mask and a pair of gloves after thorough antimicrobial hand washing. Apply clean underdrape below the patient gown. Loosen the edges of the dressing while moving bottom to up towards the insertion site. An alcohol scrub can be used to ease out the dressing. Remove the butterfly-like stat lock device along with the dressing while wiping the area with a sterile solution. Stabilize the catheter while holding the StatLock stabilization device. Use the thumb of the opposite hand to gently lift the lower tab of the retainer door. Apply clean underdrape below the patient gown. At this stage, remove the old gloves and repeat hand hygiene. Now, dip a gauze in the CHG solution and use it for cleaning the site. The motion should be from center point to the periphery as shown in the video. Allow the area to air dry. After this, clean the visible catheter portion, open the skin barrier or prep pad found in StatLock package and wipe all around insertion site where new StatLock will be placed. Wait at least 10 seconds for the area to dry and become sticky. Following this, apply the new StatLock in the following way. Place the catheter holes in the fixed post on the StatLock device and press the lids to close one side at a time. Peel away the StatLock device paper backing one side at a time and place the same. In case a CHG disc is used, place it over the insertion site with the blue side facing up, aligning the slit in line with the center of the catheter. Now, cover the insertion site and StatLock with a semi-permeable transparent membrane dressing. Ensure that the center of the dressing is aligned with the insertion site. It is important to take precautions not to stretch the dressing. Do not put the dressing while the area is wet and ensure that all edges are secured while placing the dressing. Complete the dressing by applying the final leg strip beneath the dressing to secure the dressing from all edges. Injection cap change is a process that involves removing a used cap and discarding it permanently. It is advisable to change the injection cap once a week along with the dressing change. The things required for the process are 2x2 sterile gauzes, 2 for each cap that you are changing, alcohol pads, 2 for each cap that you are changing, new sterile connector injection cap or caps, mask, sterile gloves and saline flush. During the preparation step, the caregiver will wash her hands for 30 seconds with antibacterial soap as per ANTT technique and dry using a clean cloth towel. After this, wear gloves and a mask. Keep the alcohol swab ready. If the alcohol swab is not available, please use the gauze pad dipped in alcohol solution. The Picc should be held in one hand. The caregiver will then scrub the cap of the catheter for 15 seconds with an alcohol swab or alcohol-dipped gauze pad. Old injection cap would be removed by twisting it off and discarding it. This should be followed by scrubbing the exposed catheter end again for 15 seconds with a new alcohol swab or alcohol-dipped gauze pad. Insert the new protective injection cap on the catheter end as shown. Do not touch the end of the catheter or the connecting side of the new cap with fingers. The caregiver will then check the patency of the Picc line by aspirating till the transparent lumen. Lastly, the caregiver will flush it with 20 ml of normal saline. In order to keep the catheter clean, it should be regularly flushed, injected with normal saline. In the case of dual lumen catheters, the same must be done for both lumens. Now, let us see the steps involved in the procedure. The preparation step involves hand hygiene, and then wearing gloves and readying Picc flush or manual saline. The caregiver inserts the Picc flush or syringe filled with normal saline into the connector and flushes using the push-pause stop-start method. It should be finished with a positive pressure flushing. Do not empty the syringe and leave the last 1 ml in the syringe to avoid entry of air into the system. Disinfect the needle-less connector again for 15 seconds. In the end, discard the used supplies and perform hand hygiene. Removal of the Picc can be performed in cases of therapy completion, presence of infection, inflammatory process, malposition or dysfunction, and is subject to a physician's order. To remove a catheter, make sure patient is in supine position. Turn off any infusions. Clean the insertion site with CHG solution as shown here. Grasp the catheter. Ask the patient to take a deep breath and gently remove the catheter from site. If resistance is felt, stop the removal. Apply warm compress and wait for 30 minutes and then resume. Once removed, apply sterile gauze on site and hold pressure for 1 to 5 minutes. Apply dressing and discard supplies. This concludes the educational video on the care and maintenance of a peripherally inserted central catheter line. Thanks for watching.